We're back again with autoimmunity experts from autoimmunity.in. As you all know already, autoimmunity.in is a platform where people with autoimmune diseases, they can connect, they can share their updates, and they can share their journeys and share their true inspiring life stories to be able to inspire each other on the same platform. Today, we have with us Dr. Suvrat Arya, who is a rheumatologist and clinical immunologist at his clinic, Dr. Arya's Care in Noida. Hello, Dr. Suvrat.
Hello.
I understand today we are going to be talking about a rheumatoid illness, that is ankylosing spondylitis. Before we dig into that, could you help us understand, for the sake of people who are just logging in today, what is autoimmunity?
Okay. See, to understand autoimmunity, we have to understand what is our immune system. Immune system is that system of the body which protects us from infections and the invading pathogens. So it is like an army which protects us from the intruders. If due to certain reasons it is not able to function normally and starts attacking our own cells and tissues, then that illness is called as autoimmune illness, and that state is called as autoimmunity. Various diseases are there depending upon which organ is predominantly affected by autoimmunity, such as rheumatoid arthritis, which we have already discussed, in which predominantly joint lining is the one which is damaged by the immune system, and so on and so forth. You can have various diseases of autoimmune illnesses.
Right. What is ankylosing spondylitis then?
Okay, ankylosing spondylitis is an inflammatory arthritis affecting the spine predominantly. Ankylosing means to fuse and spondylitis means inflammation of the spine. So it has been described many years back, and first case of ankylosing spondylitis goes back to what was seen in Egyptian mummies. They found that some of one or two mummies had whole of the spine fused like a one single bony structure. So this is the probably the first evidence of ankylosing spondylitis. Ankylosing spondylitis, because it is an inflammatory arthritis of the spine, it usually presents with low back pain and stiffness, and the inflammation in the spine starting from the lower back moves up, and it can also affect the neck. Around 10 to 20% of people will have other joint inflammation also, leaving extra from the spine, such as the knee joints, the ankle joints, or the shoulder joints. So this kind of illness is seen little more commonly in males as compared to females, and usually the onset is at age around 40 or less.
Right. So ankylosing spondylitis is maybe say, because generally people know spondylitis and they understand that as something to do with the spine and maybe an ache in the spine or spinal pain or joint pain, and off and on we hear more commonly about spondylitis in general. Uh, how does ankylosing make it different from the regular spondylitis that most people commonly understand?
Yeah, so this is probably one of the most important thing, that ankylosing spondylitis presents with low back pain, and so does any other spondylitis be. If it is neck spondylitis, it will be neck pain. But speaking only of ankylosing spondylitis, every low back pain is not ankylosing spondylitis.
Right.
Low back pain is second most common ailment of humanity after common cold. All of us, even including me, have experienced low back pains in certain point of our lifetime.
Yeah.
So how does the low back pain of ankylosing spondylitis different from the routine back pain which we have? It is called as inflammatory back pain, and there are certain features why it is called as inflammatory back pain. It is associated with early morning stiffness. The person says, I feel stiff in the morning. It improves on activity. The more you exercise and the more you walk, the pain disappears. And pain comes and is more severe in the night time, especially in the second half of the night. So these are some characteristic features of inflammatory back pain. And of course, it is a chronic back pain. It is not there for a few days or few hours. It will persist probably for months. and it is usually seen in the age group of 40 to 45 years or less.
Okay. So this seems to be something fairly common in India.
Yes, ankylosing spondylitis is a fairly common disease, not as common as diabetes and hypertension, but yes, it is not a rare or uncommon disease as was previously thought of. There are a lot of studies which have shown that ankylosing spondylitis is fairly common in Indian population.
So we talked about how ankylosing spondylitis impacts men of a certain age group more than women. Uh, Once we get to understand this, it's also a concern that since in India we live with our families and we have multiple situations where we're living in the common spaces and we share spaces with our family. Is ankylosing spondylitis contagious?
No. And contagious means a disease which can spread from one person to other and is probably of infectious origin.
Yes.
Ankylosing spondylitis has a genetic basis. So it may appear to run in families because there will be a common gene pool in the family. So because ankylosing spondylitis may occur in one or more members of the family, some people may think that it is a contagious disease, but it is not. It has a genetic basis like most of other arthritis. But the genetic basis of ankylosing spondylitis is little more than other diseases of autoimmune etiology, which we know.
Okay. So, in a family, when we are sort of, people are planning their family and they're looking at having children, in case one of the parents has ankylosing spondylitis, should they be concerned to pass this on to their children? So, in short, is it hereditary?
See, uh, having a genetic basis does not mean that if you have it, your children is going definitely to suffer from this disease. This just means that they may be at a little more increased risk as compared to general population. So it does not mean that it should hamper you from having a marriage or having kids, because even if genetic basis is there are a lot of other environmental factors which play a role. So the transmission is not 100%. Even in identical twins, it is not common that both of them will be getting affected. The chances of getting affected in identical twins is also around to the tune of 60% only. A lot of environmental factors also play a role. So it should not hamper you from having a family or having a marriage.
Yes. So, in India, we deal with a lot of taboos and maybe social pressures where we do not really address illnesses that openly. Now, earlier it used to be that even telling someone that you have diabetes was maybe not the best idea and people would just kind of avoid it. uh, in a similar manner, as you rightly said, ankylosing spondylitis uh, need not be something that can hamper you from having a healthy life or even having a normal life, which is having family and building a family in the future. This is really good news because we deal a lot with even HIV patients. Even today we have to deal with situations where people don't really understand that HIV doesn't get passed on by just touching. Although ankylosing is something to do with the spine, and obviously there's a little more understanding towards that, but lots of preconceived notions by people about these kind of diseases, autoimmune diseases in general. Ankylosing spondylitis can be of various progressive nature and not so progressive nature if caught on early. Uh, Irrespective of when a person, which stage this person gets diagnosed with it, how does it totally change the person's life? Because we have discussed earlier that many autoimmune diseases can impact and completely change a person's life. You have to really, really sort of build your life around that autoimmune illness. So, is ankylosing spondylitis also one of those? And if so, how? How does a person's life change?
Yeah. So see, and most of the autoimmune diseases are chronic illnesses.
Yes.
So that means they are going to stay with you maybe forever or maybe for a very long time. So once you are diagnosed, you have to understand the nature of the illness. and you have to accept the fact. If there is no acceptance, then there is frustration. Like, why only me? And why should I only suffer? So once you are diagnosed with such an illness, acceptance to that illness should be there, and then you should learn how to live with it rather than cursing it or be frustrating out of it. Ankylosing spondylitis has varied manifestations. Not everyone will be bedbound and not everyone will be fully fit. So there is no one statement to this. There are people who have very mild stiffness in the morning and minimal pain, and probably they will not require any treatment at all except at regular exercises. However, there are some people who will come on wheelchair to us or who would be absolutely bedbound, and when we start treatment, depending upon the damage already done to the joints, the response will be there. So once it is diagnosed, you should meet an expert in this disease, discuss the treatment options, how to go about it, and then just go with it and follow it.
So you discussed diagnosing this ankylosing spondylitis with the help of an expert. As we have repeatedly said earlier also on the multiple episodes, that most of autoimmune diseases require specific treatment, specific medicines, and the complete guidance of an expert who can show you the way how around these particular diseases. So a common test that has been brought up many times when we discuss autoimmune diseases is something called the ANA test. So how important is it as far as ankylosing spondylitis is concerned, or is there any other test that can help us identify or that a patient has to go through?
Okay, so yeah, ANA is used for a lot of autoimmune diseases like lupus. It may also be positive in other autoimmune diseases in which it is not a diagnostic or a specific test. It may be positive in rheumatoid or Sjogren's and scleroderma, so on and so forth. But for ankylosing spondylitis, ANA testing is not needed. The test which is important for ankylosing spondylitis is a genetic test which is called as HLA-B27. So the persons who are suffering from this disease, they know about this test, that this may have been done sometime in their lifetime, and it is a genetic test. So it is not to be repeated again and again. Once positive, it is part of your body, it will remain positive. Now, HLA-B27 is a gene which, when present in a person, predisposes you to development of ankylosing spondylitis. It does not mean that if you have this gene in you, you will definitely develop ankylosing spondylitis. For example, I will give you a figure. If there are 100 persons who are HLA-B27 positive, only 6 or 7 out of them are going to develop ankylosing spondylitis in their lifetime.
Right.
If their family members are also affected by ankylosing spondylitis, then this chance of developing into ankylosing spondylitis will increase probably to around 20 to 30%. So HLA-B27 alone does not mean that you have this disease. It just means this is a part of your body. It is a gene, and you may be at increased risk of developing ankylosing spondylitis.
Right. Thanks for clearing that up, because most people in general, when they speak of any illness, they think, oh, so this test has come positive and we're doomed, we have this illness, or even our families can get it now. And there are a lot of uninformed information that we tend to, and just tend to think that that is the right information. Now, another thing that is commonly discussed across autoimmune diseases is the use of steroids. Is there any use of steroids as in the treatment of ankylosing spondylitis?
Okay, so most of the arthritis conditions, low dose oral steroids are used. And I would stress again that as a rheumatologist, our main focus is to give lowest possible dose for the shortest possible duration.
Right.
Unfortunately, a lot of people are using steroids in ankylosing spondylitis, and there is no role of low dose oral steroids in ankylosing spondylitis. Steroids may be used if suppose one joint is affected more than the other, like a knee is acutely inflamed due to ankylosing spondylitis, then you may inject the knee with steroids as a local injection. But giving oral steroids for arthritis is usually not advisable. in certain condition like acute anterior uveitis, which is inflammation of the eye, which presents with redness, pain, and blurring of vision, which occurs in around 20 to 25% of patients of ankylosing spondylitis. In this situation also, steroid eye drops are used, and you may not require to take oral steroids unless and until the inflammation is very severe and vision threatening. In that scenario, high dose steroids may be used for very short duration till the eye inflammation settles. So generally speaking, oral steroids have no role in treatment of ankylosing spondylitis.
Yes, and that's a very interesting thing that we brought out. I think it's a very important thing also, because the moment people think of autoimmune diseases, they assume that steroids are going to play a role. And it's not necessary that every time steroids have a role in all autoimmune diseases. That's the first thing. And secondly, even if steroids were to have a role, there are many, many ways that steroids can be administered or given, which is one you mentioned about an injection, another is eye drops. So you don't need to sort of take pills to have steroids help with you through the illness. And that's a very important thing I think people need to understand. Now, there are so many lines of treatments and medicines available for various autoimmune diseases. One important factor to discuss is how expensive are these lines of treatment that we spoke about, specifically for ankylosing spondylitis.
Okay. So when a patient of ankylosing spondylitis comes, first we advise him to do regular exercise. That is absolutely free and it is actually therapeutic. It has to be there. Second is we use oral medicines, which are either non-steroidal anti-inflammatory drugs, which are also abbreviated as NSAIDs. And sometimes we use arthritis medicines like sulfasalazine or maybe methotrexate also. So these are not expensive. Maybe the cost of these therapies for a month may be less than 1,000 rupees. But there are certain patients who will not benefit from them or who will require a lot of painkillers or NSAIDs to control their inflammation. Now, these group of patients are those which require biologicals. Biologicals uh, are medicines which are developed with research. They are proteinaceous molecules, so they have to be given only in the form of injections. You cannot use them orally. And they are very targeted therapies. Like they will only target one particular inflammatory molecule in your body. So for example, you have biologicals which target TNF alpha. TNF alpha is a molecule in the blood which causes inflammation, and it is one of the major pathogenic molecules in our body in ankylosing spondylitis. So these biologicals will target it. These medicines are little expensive, but as the time is progressing, the cost of biologicals is also coming down drastically as compared to when they were launched. And we have a lot of biosimilars, which means the intended copies or the medicines which are produced by Indian pharmaceutical companies, which work almost similar to the ones which were initially developed after research in European or US. So the biosimilars cost has come down drastically, and it is coming down even more as day is passing.
So the pharmaceutical industry also has a large role to play in terms of making these medicines and lines of treatment available to patients of all cadre, patients of all socio-economic statuses. And since autoimmune diseases are now more significantly seen in India, diagnosed and significantly seen in India, it's also at the same time, I think pharmaceutical industry is also realizing that these medicines need to be made available at affordable costs for the Indian patient. We've spoken about what is ankylosing spondylitis. We've also seen the treatment and the medicines. Once a person is diagnosed with ankylosing spondylitis, he has to manage his lifestyle around it. And off and on, he or she tends to get something which is called a flare. Can you elaborate a little bit more on what a flare is?
Yeah. So flare for any arthritic or autoimmune illness means when the symptoms suddenly become worse It could be because of the intrinsic nature of the illness, because most of these illnesses have waxing and waning course. So they may have certain flares on their own during its own course, or sometimes when you are coming down on the medicines or you have stopped the medicines, then you may have a flare. For ankylosing spondylitis, a very characteristic thing is that if you have a urinary tract infection or a GI tract infection, at that time there are more chances of having a flare. So a typical history will be like that: a person of ankylosing spondylitis who was doing well on the regular treatment, he developed an infective episode of diarrhea, and within next few days or weeks he developed flare of symptoms in the form of worsening back pain or pain and swelling of the knee joint or some other large joint. So this flare can be managed in many ways. First is to optimize the therapy, find out the inciting cause so that we can prevent recurrent flares, and to ensure the compliance of the patient. Another important thing I would like to add is that smoking. A lot of males who have ankylosing spondylitis are smokers. So smoking has been found also an important environmental factor to initiate ankylosing spondylitis. Also, smoking is one of those factors in which the response of therapy is not adequate if person is a current smoker.
Yeah.
So this could be another reason for having repeated flares or inadequate response. So that also has to be taken care of.
Right. I've also observed from my personal journey that, as you know, a simple thing like a small infection tends to just take you downhill so fast, and you know, your autoimmune illness starts to actually becomes the more important thing to get treated, rather than maybe the a UTI that you have, or a simple cough or cold that you've picked up from somewhere. And because your immune system is already on the overdrive, they want to sort of, you know, fix that problem. And in fixing that problem, the immune system goes on an overdrive, and that's exactly what happens, and sort of takes you downhill very, very fast, which is autoimmune patients or people with living with autoimmune diseases, to successfully live. I think we just basically need to be, you know, more careful about how exposed we continue to get to bacteria, viruses, generally more exposed to situations that can, you know, get us various other infections, because that is the one short thing to, you know, give you a flare. On an average, an ankylosing spondylitis patient, how often, is there any number? I mean, I understand that this is a very subjective question, but is there a number where, on an average, a person tends to get, as this much often he tends to get flares? Is there some kind of a number that one tends to sort of?
No. There is no number, because it depends from patient to patient, person to person. Important cause maybe in our setting could be non-compliance, because India, there are so many various modalities of treatments are available.
Right.
Sometimes people go and try the other modality. So we see flares a lot often when patients either stop treatment, reduce their compliance, or change the modality of treatment.
Right. That is very true, that patients tend to maybe think that there are other alternative methods where they can seek, probably reduce the toxicity of allopathic medicines, but that's a separate topic altogether. How often do you see your ankylosing spondylitis patients progressing really fast and ending up in a wheelchair, or, you know, getting really compromised in terms of mobility, from like somebody who's diagnosed not so much when he started off, but then things were not really working out for him? How often does that happen? Because that tends to give an, you know, a picture to an average Joe or an average person how scared or how worried we should be about this illness. Because sometimes it can come off as more threatening, but it's not necessarily that bad. You can actually live with it successfully.
Yeah. See, I cannot recall of any single patient who was like, who became so worse that he became wheelchair bound and was fine initially.
Mm.
The as soon as the pain and inflammation start, the response to therapy is also that good. If a person is who is not responding on oral tablets, they should have patience, because sometimes these medicines take time to act. If you leave the medicine within few days that it is not working for me, and then keep on changing the doctors or keep on changing the medicines, then it is not going to help you at all. So if a person who is not responding to oral medicines, we always have injectables and biologicals. And the success rate of biologicals is good. 70 to 80% of people will respond, and some may respond less and some may respond more. There are people who will have refractory disease to biologicals also. So now new research is going on, and probably after some time we are going to have newer medicines, newer oral medicines, which are even more targeted. And because the trials are still going on, I do not have the results of those, but whatever we have heard is that it is very encouraging. And probably after some time, maybe a few years later, we will have very targeted therapy based on individual patient. We may be able to take their blood sample and find out which inflammatory molecule is high, and we will target only that, because not everyone will have same signature, the blood signature, because of the illness. So we are still in a very early phase as far as treatment of autoimmune disease is concerned, and the pace at which research is going on, hopefully these tailored therapies will be available at least sometime in near future.
Yes, that would be, I think, a blessing in disguise, because the sheer nature of autoimmune diseases and how different they are, as well as how um, there are so many elements that come to play when a person has an autoimmune disease, that it becomes difficult for the person living with it to be able to figure out, yeah, what's going on. And sometimes even the doctor who is under whose treatment they are, to be able to create a healthy balance between so many elements, to be able to give a fulfilling life to the patient. And I personally have seen that challenge, to be able to balance various things and still give me a healthy, functioning, and happy life. Uh, as an autoimmune disease person and someone who has it, one very important thing that I noted when you said was, don't keep changing your doctors, just have faith in patients. Eventually the medicines will get to working for you, and you can figure out what's the best thing to work for you. How often and how good is dietary changes and supplements for an autoimmune patient?
Yeah, see, there are various theories and there are various claims made. But having said that, there is no very strong proof or research into this that one particular diet is very good and one particular diet is very bad. In as a general term, I would say healthy, balanced, nutritious diet is important. There are certain factors in diet which are known to have inflammatory potential. These are high in sugars and high in fats. So once you have disease, or even if you don't have disease, even for a normal person, high fats and high sugars are not good. Then we should encourage taking diet which has little anti-inflammatory potential. Some research has shown that they have antioxidant and anti-inflammatory potential. These are fresh fruits and vegetables, a diet which are rich in omega-3 fatty acids like nuts, walnuts, almonds, chia seeds, flax seeds, avocado, olive oil. So these are the diet which may have some anti-inflammatory potential. But giving a blanket statement that don't eat rice, don't eat potato, don't take this, don't take that, doesn't make sense, because a lot of these people do not have any problem even if they consume this. So I would say have a healthy balanced diet and avoid things which are known to provoke inflammatory state.
Earlier, you mentioned about turmeric. I think turmeric has a huge anti-inflammatory uh, component, and most often, and even today these days for Corona, people are having that golden milk, and so it's been termed that, I think, in the West, it's been called the golden milk, and it seems to make the virus go away, which is absolutely untrue, obviously. But yes, it does have anti-inflammatory components, I think, which any which case in Indian cooking is there. So I don't think one has to really go into that extra, I have to have this much turmeric every day and then only my autoimmune disease will go away, or any of those misconceptions. Thank you for clearing that out, because a lot of people, as we discussed in our the other episode on immunity, that people tend to think that diets can make their autoimmune disease go away, and that is absolutely not true. It's just therapeutic. It basically makes you feel good and healthier, and one should just expect that much from it. You mentioned exercise. That's a very, very important component, I suppose, in ankylosing spondylitis. Could you talk a little bit about that?
Yeah. Exercise is very, very important. It is important for all of us, but for ankylosing spondylitis, it is probably the most important because as the disease progresses, there is fusion of the spine bones occurring. That is why patients feel stiff, and if untreated, the whole of the spine may fuse into single one bony column, and the mobility of the spine will be lost. Through medicines, we are controlling the inflammation happening at the bones, which leads on to fusion of these bones together. But exercise is absolutely essential to maintain spinal mobility, be it deep breathing exercises, be it spinal extension exercises, or be it exercises like running, jogging, cycling, or swimming. Swimming in particular is very good because the buoyancy provided by the water helps you exercise more, and swimming somehow is very good for all the bones, your all the joints and the muscles. Your back muscles are used, your limb muscles are used, and that is how I would say that exercise is probably one of the most important. In fact, in most of the guidelines, the first line is regular exercise. It may not be a physiotherapist guided or a doctor guided. You just have to learn it and do it on your own. Now, in Indian culture, we know about yoga. There are, because it causes stretching of the spine and other regions, and Surya Namaskar. Surya Namaskar is one particular posture, one particular yoga posture in which you do all the spinal movements, and it is extremely beneficial for patients who have ankylosing spondylitis.
Yes. Right. So yoga, physiotherapy, regular exercise will definitely help one manage the illness a little better. Since we are in these COVID times, is an ankylosing spondylitis patient, does he have to take any further precautions other than your regular, the ones that are prescribed now and we've gotten used to, which is sanitization, social distancing, wearing a mask, good ventilation? Besides this, is there anything else that an ankylosing spondylitis patient should be aware of?
So, like we had discussed in our previous session also, that probably the risk of catching the virus is not more. It is just the same probability as other people. But if you get it because you have an illness which is affecting the immune system, the disease course may be a little more severe as compared to a normal patient. I have few patients of mine of rheumatoid and ankylosing spondylitis who had it and have recovered normally as a normal person have recovered. So it is not that the chances of mortality are very high or the complication is very high. It is not true. On the basis of whatever treatment a patient is getting, if it is suppressing your immune system, then it is a different thing. You must consult your treating rheumatologist. If you are on biologicals or other therapies like arthritis medicines, if you get COVID-19, what to do about it? We have to stop it, we have to change it, or we have to hold it till we recover. But for most of the data which exist, these biologicals like TNF alpha blockers are not putting you at a very high risk of having COVID-19 complications. But you must be in touch with your doctor because every patient will have a different course and it has to be tailored separately.
Yes. So through COVID times, it's important to be in touch with your doctor. Always seek expert guidance. There is a need and a necessity for ankylosing spondylitis patients to visit hospitals for regular updates and treatment as well as X-rays. Uh, does this make them more susceptible to COVID? And if so, what precautions again can they take? And is there a
Yeah.
way? Is it a misconception that an X-ray is required more often than for a patient?
Okay. See, if a patient is already a diagnosed case, then because of this teleconsultation happening, uh, rising up very rapidly in our Indian scenario, I don't think a patient who is on stable dose of medicine should come to hospital.
Right.
Follow-up can very well be done on teleconsultation. A visit may be needed if there is a flare or an unsorted thing which needs to be sorted out. X-rays are not needed regularly. It is only needed at the time of diagnosis, or if you are suspecting some kind of a bony injury or some other issue which is not sorted. So regular X-rays, regular MRIs are not needed in a stable ankylosing spondylitis patient, and they need not come regularly. At this time, they can very well be followed up with teleconsultation.
That's a beautiful thing. Just to wrap up this particular segment of ours, the last bit that I wanted to ask you was this environment of people living, in a very silos environment where people are not meeting each other as often. Uh, do you think that an ankylosing spondylitis patient would benefit from being a part of a community or seek mental health support of any nature? Is it integral to the healing and the maintenance of this autoimmune disease?
Yes, yes. This is another very important aspect. When you get to know that you are not alone, it gives a very, very good mental boost, because most of the autoimmune illnesses patients feel very alone because these illnesses are rare. They may not know anyone, they may not know in their friend circle or in their relatives that someone has this disease. So
Yes.
when people around you don't have this disease, they don't understand also. They don't understand the kind of pain you may be going through. They don't understand the difficulties which you face day in, day out. So I'll again quote, which I have spoken in other sessions of ours, that when in our OPD at SGPJ Lucknow, there was a large patient gathering area, and patients used to meet and speak to each other. They had become friends, and people coming from the same locality started traveling together. There, the maximum impact of talking to another person was when someone suffering from the same disease shares his experience with you.
Yes.
That is even more important than us telling them what is the course of the disease, if they hear the same thing from a person who has gone through this. So I believe that such initiative as yours is absolute necessity. These are very common in Western culture, be
Yes.
it Europe or in United States,
Yes.
that patient support groups are there, and the moment you are diagnosed with a disease, you are introduced to such people, so that you don't feel alone. You can share your stories and you can inspire each other. Unfortunately, in India, this is not a very common trend, but the scene is changes rapidly. I know of a lot of other disease oriented support groups in which people can discuss with each other and can discuss about their journey and thoughts and experiences. So
Yeah.
I think this is another very important aspect which needs to be addressed.
Thank you very much for always sparing the time, to simplify. And since today we spent, I think, a good amount of time simplifying ankylosing spondylitis and the myths and fears and information about it. Once again, let me thank you, Dr. Suvrat. And to our audience, I would like to continue to be able to bring you these episodes. So please like, share, comment, engage with us, subscribe to our channel, and most definitely let us know what you guys want to hear more about. That way it helps us figure out what you are dealing with and what are the challenges that we can simplify for you, what illnesses we can talk about. Thank you, Dr. Suvrat, for today's session.
Thank you.